Grand Rising, everyone. Welcome, University. We are AMBETTER. I got a lot of great stuff to share with you all. I'm Shondell Coleman. I'm out of Chicago. Been with AMBETTER for about 7 years. Devoted 7 years of my life. Hey, some of you all did about 20, 30 years in the industry. So appreciate this. We do got a lot of information. Go ahead and get started here. Feel free, any questions at the end, and we'll go from there. So okay, so some of you all are, existing agents, new agents, so some of this may be a refresher for you. But I want to note and let you all know, and better, we consider ourselves being the number one marketplace carrier. And better members that go out and shop for us, we pretend to be the number one based on price and network. As I said before, I've been wearing better for 7 years, so it's amazing to see the growth that we gained at about 4.3 million, being in 29 states at that, and being in the managed care industry for about 30 plus years. And in addition to that, we're number 22 on the Fortune. So that tells a lot about the company and financial stability as well. Okay, so we're going to be entering Iowa for 2025, new state for us. So if you are licensed, got some business there, or looking to sell there, make sure you follow up, with your upline and with myself as well, and then we can get you appointed. Keep in mind, AMBETTER has exited out of New Mexico effective December 31st this year. In case you are wondering, you don't know about the network or anything around Iowa, again, just follow with your upline or myself directly, and I'll be happy to assist. Strong partnership. This is one of the great things that we are really, valuing ourselves and for our brokers, that we're one of those carriers that provides new and renewal competitive commissions. Never pull without commissions at all in all of our states. You get a great account executive like myself, very dedicated. You get also a dedicated broker sales support team to give quick solutions to your issues or concerns. You got a broker portal to manage your book of business. I understand a lot of brokers out there use Health Sherpa, which is perfectly fine, but it's also great also, just to cross-reference your book of business. CMS action, you all know this. This is out, but we just putting this as a refresher, let you all know. CMS took quite a big steps into blocking out authorized enrollments, complaints that's beginning, as well as AMBETTER, right? We had the AOR lock-in and doing our best on our end to track these enrollments, as well as seeing the flow of enrollments that come through the door. Okay, so taking those extra steps, three-way call, doing these things for your member just to protect yourself as well as your member and your book of business. All right, some updates for AMBETTER. So as you know, gold, silver, bronze, our meta tiers, which were known as core, would now be Premier Network. Okay, starting the start of open enrollment. I do want to note that a copy, of our presentations. You all know we got webinars going on. There will be a copy of our state webinars at the very end of October, at the start of open enrollment. There will be a copy of it in your portal. Going back to this, members have access to their AMBETTER Health app, which launched back in July. We got your portal, which been enhanced a bit. So that's going to be included the renewal letters during open enrollment for you to have access to. And then you also have the option to set up auto pay in all of our states from your portal. We're expanding into Iowa. AMBETTER created a diabetic condition specific plan for those diabetic members. It's only going to be available in Florida, Georgia, North Carolina, New Jersey, and Tennessee. Plans no longer being offered in the state of New Mexico, and AMBETTER virtual access plans have been discontinued. Okay, keep in mind, Premier Network name change does not apply to Washington. All right. Moving on to plan offerings. Just keep in mind, all members have access to virtual services through Teladoc Health. Okay, 24/7 help, non-emergency, rural areas, regardless of your location, avoiding those long wait times. Just letting you all know this is accessible and available for all of our members. Renewal letters. So going on in September, renewal letters were sent notifying members if their plan has been discontinued. Okay. And if it has been discontinued in any of our states, we put them on a plan that's most closest to the plan that they were on, right? October, renewal letters sent for members with plans that will continue. And then in November, you all as brokers will be able to have access in your portal to see those renewal letters during OE. Binder payments. So very important. You enroll a member, getting that payment in is very important. It's how you get paid, commissions. We on our end and better is taking extra steps as well into sending out notification for the member to make their payment, their binder payment. So we're doing emails, we're doing text, we're doing outbound calls, we're sending out communication, just encouraging that member to make their payment. Okay. And as we know, as you as brokers, you're doing your due diligence, but also AMBETTER, as we're doing on our side to encourage these members to get their payment in on time. Payment outreach. So, those members, existing members, past due, we are sending notification to those members as well, 30, 60, 90 days. That's late. So they are getting that communication on their end to ensure, they make their payment on time. So what comes in the packet? So some of the information that comes in the packet, members get their ID cards, information around the networks, some member benefits and programs in there for you. Also, this is good to know too that member has to make their payment first. So that's when they're within 7 days they should get their welcome packet. I know that some members might miss that. Well, hey, I haven't got my pack. Well, hey, make sure you make your payment first. Okay. Okay, so the new member bonus. Okay, this is not the bonus. This is not the finalized bonus. This is a new member bonus that Ambetter did last open enrollment. Okay, I'm just giving you guys an outlook at this on how it was structured. So more to come on that. Okay, more to come on the finalized one. But just think about it. If I were to get this amount of members within this specific tier or so, I can make this much. Wow. So I definitely want to put this on you guys mind to start, thinking where you want to land in your membership as well as where we may have great opportunity in, right? So if you need to follow up with me directly, like, hey, Shondell, I want to talk to you about some of the markets, where are the markets where good opportunity at? Hey, let's talk about it. Okay, so I'm gonna start with a couple of states. Okay, it's a lot of information, 29 states, right? And I'm only focused on a couple of states here where the agency or you all saw where I saw seen great growth in, and that was starting off in Florida. First and foremost, I want to say how devastating it is and saddening it is to hear about the hurricane. So for those that's residing there, that has family there, just a lot of power outages and damages, and did a lot to the stress and anxiety. So prayers to those out there. And yeah, but moving forward though, I'm thankful for those that's that's been safe. Okay. So starting off in Florida, what's new for 2025 in Florida? So bronze, silver, gold, as I said before, network is now the premier network. They'll continue to be the same group tier, etc. We do have Pacific plans for those members with diabetes that are through the premier network. Florida is going to be expanding to Martin County for 2025, Martin County. We got the new release app that launched in July. We got the renewal letters that's going to be available in your portal, the start of open enrollment. Keep in mind that Florida, we used to be the Sunshine Health branding. This is the name of the state health plan. All of our states, whatever. So it used to be Sunshine Health. It's now going to be called AMBETTER Health National Brand. We're going to use AMBETTER Health National Brand moving forward. Exiting members that was in the core enrolled for 2025 is required to make their binder payment no later than December 31st, just so they can keep their coverage. And then we have AMBETTER Select and the AMBETTER Virtual Access plans that are no longer available. All right, this is our county coverage for Florida. You can see in the raspberry colors, those are our current, counties that we are in, our premier. You see the expansion for 2025, which is Martin County that we're expanding into. And then we have our value portfolio counties. Those are the counties we're going to be in for 2025. All right, some of our highlights for network. This is just a partial provider list. This is not all of our network. So just some pinpoint some of the networks we have in certain areas for you to let them know we still have them from 2025. Again, if you need to follow up anything around network, I would say, follow with your account executive like myself, obviously. So if you have any questions, we can definitely talk about it. But just a partial list. So still in Florida. Okay, moving on to a premier portfolio. Same thing that was on exchange and off exchange too. But this is more members where they can cross state lines, which I think is a very big seller across the state lines. If you're in Florida, you can go to Georgia, Texas, Indiana, whatever, as long as that provider network. Those we have those specific designs, diabetes, which is offered in Florida. Okay. When searching our provider guide, looking up in-network providers, you will want to choose Premier to locate any network providers. Remember, that used to be called Core. And then we have adult vision and dental that are available on many of our plans. So those with diabetes, our Premier plans in Florida, we have specific plans for those members. These specific plans will cover medication, supplies, and support. Okay. These plans have a $0 copay for certain other tiers of the preferred insulin and medications. So anything around diabetes, blood pressure, cholesterol, mental health, and you have the $0 copays for, I said, the supplies and strips. So you will need to refer to the formulary guide, okay, to our formulary to see for those medication and supplies. And keep in mind those $0 copays are for any day supply. All right, this is our whole portfolio, the Florida HMO portfolio for Premier. You can see for bronze, silver, and gold. Bronze, we have the elite bronze, everyday bronze, and the standard expanded bronze. For silver, we have the elite silver, focus, standard, and then there's the enhanced diabetes care silver with the $0 drug option. And then we have our gold complete, everyday, and standard gold. All right, starting with our standard expanded bronze. Okay, this specific plan has a $7,500 deductible, 9,200 max out of pocket. There's a 50% co-insurance. For this specific plan, the virtual 24/7 care is $50 copay as well as the visit for PCP. You see the lab is 50% at the deductible, which means after the deductible is met. Okay, and then you have the preferred also $50, and then you have an urgent care at $75 copay for this. All right, we have our enhanced diabetes care silver. This has a $0 deductible, lower maximum out of pocket, and copays at the 94% actuary value. This plan starts at a base at $5,000, goes as low as $0. Goes as low as $1,250 for the max out of pocket and the 30% co-insurance. There's $0 for virtual 24/7 care across the board. And then you have our urgent care, which starts at $30 and goes as low as $5 respectfully. So depending on what where the members fall and income level, you'll see what be the best option for the member. This is the Focus Silver. Has a lower cost silver plan that includes copays for PCP, specialists, urgent care, and generics. This starts at a base at $6,300 deductible, goes as low as $0, goes as low as $1,350 under the 94% actuary value. This plan also has virtual 24/7 care, $0 across the board, goes as low as $0 for PCP visits as well as lab. And then there's $0 under the 94% actuary value for preferred and generic RX. And then this plan goes as low as $10 for the urgent care. Standard silver. So this standard silver has a $0 deductible and $0 PCP visit at the 94% AV. Keep in mind, this plan does not include vision and dental. Starts at a base at $5,000 for the deductible, as low as $0 for 94% AV. Goes as low as $2,000 for the max out of pocket. Goes as low as 25% on the co-insurance. There is a $40 for virtual care under the base, as well as the 87%. And then there is $0 for under 94% for virtual care and PCP. This Pacific plan goes as low as $5 on the urgent care. All right, so this is a comparison, a silver comparison at the 94%. Okay. So you got the focus silver and the standard silver, just compare the two, $0 deductible and $0 for PCP visits on both plans. Max out of pocket 1350 and 2000. Virtual care and PCP visits $0 on both. And then for urgent care, $10 and $5 on both plans. So just a bit of comparison for you. Everyday Gold plan copay. This starts at $750 on a deductible. Max out of pocket at $7,000 with co-insurance 35%. Virtual care is $0. PCPs and labs are $35, and the urgent care on this plan is $35. All right, so for the value portfolio highlights for Florida, okay. So as you know, Florida has different networks for the value, which is available in 11 counties in Florida. You know, any members, you know, they are assigned to a medical group or a PCP. Okay. Any changes that they need to make or to PCP will have to go through the member portal, or the member, you know, can go by calling customer services. Keep in mind also, you know, crossing state lines is available between the value network in Florida and in Texas. And, you know, let the member know, you know, when scheduling those appointments, because there's different networks, the member should say that they are on an AMBETTER value member. Okay. And make sure that provider is part of the AMBETTER value network. Very important. And then eligible to earn My Health Page rewards, where they can earn up to $500 doing different activities. And note that dental and vision is not available for Florida value plans. All right, here's the product portfolio for Florida Value HMO. So we got the bronze, silver, gold, bronze, elite value bronze, standard expanded bronze value. Under silver, we have complete and focus value silver and a standard silver value. And then gold, there's the complete value gold and the standard gold value. And then you can see there at the bottom, value portfolio available in those following counties. And then also value plans, they do not offer the dental or vision. All right, so starting off, value, this is the standard value silver. This has a $0 deductible and $0 PCP visit at the 94% actuary value. Does not include vision and dental. Start at $5,000, goes as low as $2,000 for the max out of pocket, goes as low as 25% co-insurance. There is no charge for virtual 24/7 care across the board. And then you can see for goes as low as $5 and $0 respectfully for the 94% AV. Okay, I am transitioning now to Georgia, our peach state. So what's going on in Georgia? The same as Florida for all our states, right? We're starting going from core to premier network. All right, this plan also has specific plans for those members with diabetes that are through the premier network. We got the new launch app, renewal letters. And then you all know Georgia has launched and moving over to state based Exchange Georgia Access. And then we have our new off exchange only network that is offering Georgia, which is called AMBETTER Health Solutions. So current counties, and as you can see in the raspberry, it looks like there is no expansion for Georgia 2025. But we're still consistent. This is just a partial list for Georgia, just some highlights of our network. Okay, you have the core or more the premier network, and then you have the AMBETTER Select network. All right, those with diabetes. So you know, we have specific plans in Georgia. Okay, for those that's with diabetes, these kind of plans do have a $0 copays for certain of our tiers and prefer insulin as well as for mental health medications. And you all have to also, you know, refer to our formulary guide for any, you know, medications as well. Highlights, portfolio highlights going to Premier, available in all health counties. We have those specific design plans for diabetes, members being able to cross state lines and any network provider. And then we also have adult vision and dental that are available in our plans. So we're still on Georgia HMO portfolio, bronze, silver, gold. We have under the bronze, clear bronze, the choice bronze HSA, everyday bronze, and standard expanded bronze. Under the silver, we have the complete silver, clear silver with the $0 incident options. And we have the focus standard silver. And then gold, we have complete, everyday, clear, elite, and standard gold. And then clear silver plans, with the $0 insulin does not have vision and dental. Starting with the clear bronze, this plan has a matching deductible and a maximum out of pocket, has a $0 PCP visit and lab. This starts at $9,000 for both the deductible and max out of pocket, 0% co-insurance and virtual care. And then the PCP visits, labs are all 0% after deductible is met. And then this is a $60 for urgent care. All right, this is the standard expanded bronze. This has to start off as a $7,500 deductible, copays and reduced costs for lab, 50% co-insurance. There is $50 copay for the virtual 24/7 care as well as the PCP. For lab work, 50% after deductible and the RX preferred. And then this plan has urgent care at $75 copay. All right, this is the clear silver with the $0 insulin option. Does not have vision and dental. This has a matching deductible and max out of pocket. Start at a base at $6,500 as well as the max out of pocket and goes as low as $800 under the 94% AV. Zero co-insurance on this plan, and then $0 virtual care. And then for this plan, there is 0% after deductible for both the preferred generic RX. And then there it goes as low as $5 for the urgent care on this plan. All right, Focus Silver. This plan has a $0 deductible, lower copays, which starts at 87% AV. It has a base at $6,300. Goes as low as $1,350 for the max out of pocket. There's virtual care, which is $0 across the board. Goes as low as $0 for the lab work, depending on where the member falls. And then there's urgent care that goes as low as $10 under the 87 and 94% actuary value. Standard silver. This standard silver has a $0 deductible and a $0 PCP visits at the actuary value of 94%. Goes as low as $2,000 for the max out of pocket. Goes as low as $0 for both virtual and the PCP visits. And then for the specific plan, it starts at $60 for the urgent care and goes as low as $5. Clear Gold. We're on the Clear Gold. This Clear Gold has a lower cost premium gold plan. Starts at a $9,900 for the deductible, $8,400 for the max out of pocket, 30% co-insurance. It is a 30% after deductible for the lab. And this plan is a $60 for urgent care. Everyday Gold. This plan is $750 deductible, $7,000 max out of pocket. Virtual care at $0, $35 for lab. And this plan has $35 for urgent care. Okay, still with Georgia, we have our select portfolio for WellStar. Have our silver and gold, standard silver select WellStar, and the standard gold. Those do not have division of dental. And then the select portfolio for Piedmont, that's standard silver select plus, and the CMS standard gold select plus, which also does not have adult dental vision and dental. Okay, Georgia select portfolio for St. Joseph and Candler. And then we have select portfolio for Gwinnett. These both do not have vision and dental offerings for either. Off exchange offerings. This is what I had mentioned in earlier on. Off exchange. So we have new off exchange plans for 2025 called AMBETTER Health Solutions. Okay, for those that do not qualify subsidies, you get the same as on exchange, same benefit, crossing state lines, all that great stuff. I do want to let you all know, and I don't want people to get confused by the map that you can see California on there. I will let you all know that AMBETTER is through Health Net, which is a different entity through AMBETTER, which is California-based plans. You will have to reach out to Health Net, and you can look this up too. It's all up on there. If looking to do any business there. So I just want to note that because I know it kind of get a little bit confusing on our map. Off exchange plans. You can enroll these members through our enrollment platform, which is powered by Health Sherpa. If you have your own personal account, that's fine too. You're gonna it's the same thing. Amber Solutions going to be offering these following states: Georgia, Indiana, Ohio, Missouri, Mississippi, and South Carolina. As you've seen, you didn't see it on Florida, so it's only in these following states. So AMBETTER Health Solutions moving forward for off exchange. And in addition to this, for those agents out there that do a lot of ICRA, we're definitely looking to see what that business looks like on that side. But any member can go on AMBETTER Health Solutions. Okay, keep that in mind. Anybody. So this is AMBETTER Solutions County. As you can see, everything in blue. Doesn't seem to be an expansion there. And here's our portfolio. So our portfolio for off exchange, we have the bronze, silver, gold. The bronze starts at 1,800, 5,000, 7,000. There's the HSA 6,400. And then silver, 1,350, 3,500. And then up to the HSA and the copay HSA that we have. And then we have our gold health solutions, gold 1,500. And then it goes down to 3,500. So starting with the bronze, 7,000. This has a lower prescription cost at the deductible, 7,000 for the deductible, 8,500 for the max out of pocket, 50% co-insurance. This has 50% at the deductible for lab, and then this has a urgent care of $55. This silver 4,500 have 4,500 deductible, 9,200 for the max out of pocket, 30% co-insurance, $0 for virtual care. And then this plan has an urgent care of $35. This plan is the gold 3,000. Has 3,000 for the deductible, and there's a 5,000 for the max out of pocket. It has 20% for co-insurance, but it is $0 for virtual care. Lab seems to be 20% at the deductible, and then 50% for the preferred RX. And then this has a $50 urgent care. Okay, now we're on to Tennessee. I believe this is the last state. Just want to cover a couple states, but Tennessee. So what's going on in Tennessee? Same, stuff with the other states. Premier Network still the same. New launch app, renewal letters, and then AMBETTER Select plans are no longer available. Tennessee. Statewide. We're statewide again, y'all. Not pulling out. Some of the highlights for the network, just a partial list, some just pinpoint of some of the areas in Tennessee where we have our network going into 2025. All right, here's the portfolio available on our counties for the Premier Network. We have those Pacific design plans for diabetes. Just make sure you go to our provider guide, and then those digital inventory are those plans. So those specific plans, same as the other states I mentioned, covering medications and supplies. This has a $0 copay for some of the certain those tiers and preferred insulins and medications. Product offerings, this is the portfolio for the Premier. Got the bronze, silver, gold, elite bronze, everyday, and standard. Then there's the clear silver, enhanced diabetes, focus standard, and then elite, everyday, and standard gold. So I'm gonna go through this a little. Okay, elite bronze. This has a $0 deductible, max out of pocket $9,200. Urgent care is $60 for this plan. This enhanced diabetes care silver starts at $5,000 as low as $0. And then it's goes as low as $5 for the urgent care. So I know we're on time a bit, but be moving here. Focus silver starts at $6,300 for the base, goes as low as $0. Goes as low as $1,350 and $10 for the urgent care on this specific plan. This standard silver starts at 5,000 base and goes as low as $0 for the deductible. Virgin Care is also $0 on the 94%. And then the preferred generics are $0 and goes as low as $5 on the urgent care on this plan. Standard silver. Elite Gold, this has a $0 deductible with low cost PCP, $0 deductible, 5,500 max out of pocket. Okay, urgent care is $35. Everyday Gold, this plan $750 deductible, 7,000 max out of pocket, $35 for the lab, and $35 for the urgent care. Okay, I think we're done, wrapped up with the plans now. So now we're moving a bit more. So this is the adult vision plan offerings. So there's no waiting period. I do want to let everybody know. It used to be called Involve. If anybody asks or you need to know, hey, what's you all network for vision and dental? It is going to be called Centene, Centene, Centene. That's the name of the network. So this has $0 copay for eye exam, one visit per year, covering up to $130 for the frames. Lenses covering up to 100%. 19 years age of older in network only. And these are add-on designated plans as a bundle. The dental with no waiting period either. Class 1 routine exam, $0 copay. There's 50% as you get into the class 2 for minor work. And then 50% co-insurance for class 3 as you get more into the major dentures and crowns. $1,000 benefit covering in network only. Broker portal. So just a refresher, if you haven't logged into your portal, it's always great to log in your portal so you can see your book of business as well from the AMBETTER. And you can download that. Give Broker Support a call if you need to. And then here's the URL, broker.ambetterhealth.com. So as you're in the portal, as I said, it's always great to cross-reference, right? And then also with the changes in CMS, AORs, and all that stuff, you want to make sure that your book of business is intact. So you have a lot of information in there. Check your book of business, delinquents, download it, resources tab. If you haven't have a chance to do that, go to your resources tab. You're going to find a lot of great training and marketing materials. Even if you need to print any brochures or anything like that, you'll have to do that on your end though. Keep in mind the policy is not active until that binder payment is made. Very important. And that's how you get paid. And then you can also make a payment through your portal if need be. So again, you can download this Excel, whatever you need to follow with those members. Ways your member can make a payment: phone, mail, MoneyGram. They can update it through auto pay, enroll in paperless, and download invoices all through their member portal. Training materials. So this is what I was saying, you all, what's in your portal. You found some great information being around the plans, off exchange, ID cards, a reference guides for you, map. Anything around our benefit and programs is in there for you. Okay. Also our enrollment platform. If you need to get set up with that, you need some step-by-step. And the media, everybody's in their phones too. So social media, you can find some great information around that. I do want to let everybody know too, if you are in need of, I like to say, AMBETTER swag. If you got some events and you say, hey, I need some AMBETTER goodies, just let me know and I could take care of you. You got some stress balls, pins, and some other stuff. They are state specific in there. So, all of our state specific around the plans and networks are also in your portal. Access to the provider guide, go to guide.ambetterhealth.com. That's the URL. Make sure you save that. Network change. So if you're in the provider guide, right, you're going to see the AMBETTER Health Solutions, which is our new off exchange plans. So it's not going to be called Core or anything like it's going to be called Premier. Now, if you go to states like Florida, Georgia, which has their own network, right, with either select, value, whatever it is, make sure you select the right year in the network. Formulary. That's what I was talking about with the diabetic plans and all that, or just medications overall. Go to ambetterhealth.com, hit the drug coverage. Make sure you select the state first, so that's tailored to it. It's quite a big file, so you're going to hit Control F, put the medication in there, and see if it comes up. Either it's a 1 through 2, 3, whatever. If it's not in there, then it's not covered. If there are exceptions you need to go through customer services for that. But you may can find some generic drugs that's aligned with the drug that you're looking for too. That can be in our formulary. My Health Pays. So 500,000 members activated My Health Pays. Okay. This is just a quick to let everybody know, and from my health page, members that enrolled in this are likely to renew. And members have collectively earned $52 million in rewards. Again, this is where a member can earn to 500. Well, hey, what are you talking about? Well, this my health page, these members can earn points to just do different activities. Easy, very easy, fun, different surveys. They use these points to shop on our online reward store. They get this nice raspberry card there. Like myself, when I first started, I got 500 free dollars, right? And just by doing different activities from the portal, that's it. Great. Converting those points to dollars. Well, hey, what else can they do? Hey, healthcare related costs. We got the premium, co-pays, deductibles, co-insurance that they can use it for. Well, hey, what else? Monthly bills. We all got bills, right? We got utilities, we got cell phone, transportation, and it goes on. We can pay, use my health pays for it. You can reduce your premium by $41. What? 40? Yes. If there's a disadvantage in a certain area or county, let the member know. They doing these activities, you get 500 free dollars. And this is a flyer that's also in your broker portal. It's something you can, share with the member, give them a down, outlook of how this looks. Does have to be 18 years or older for it. Member discount. So if you have any members out there that's into, getting fit, losing weight, we have discounts around gym memberships. Discounts. Go through Benity.com. Go through Benity.com. You sign up for it. You can find some of the things that align with, discounts. When you do register, use the registration code Member Perks in there. So just for your reference. Member support, this lets you all know members have access to this across different programs that they can take advantage of. We got Start Smart for your baby, a 24/7 nurse line. We got the CRC Center, a care management and health management program. Now the app, we're at the app. Well, hey, what's this app you was talking about, July? We launched a new app in July, you all. Everybody's in their phone. Let's talk about this. We understand members are not tech savvy or in the computers, right? And they're coming to you to do the work and all this. Hey, you talking to them? Hey, download your phone. Go to your phone. Go to your app store and download this app. You can do everything from the app. Anything around ID cards, claims, billing, anything around auto pay if they need to do that. They can do so from the portal. From their phones. So it's only available for iPhone and Android. Just go to the Apple Store to download it. You can download it as yourself, right? And again, in addition to this is a great benefit, you all. And they get this in the welcome packet too. But I think this is a great thing to let members know that, hey, download that app. Now here's the contact information, broker sales support. This is all the things that they do. Anything around memory related issues, commissions, anything around systems or providers. You can reach out to them, 855-700-7985 option 2, or you can email them, AMBETTER at Centene. And then you have broker sales, which is my side, which help with contracting, any educational that you all need around training or marketing collateral. My number is there for you. Sales is there for you too, but my number is there, Shondell. That's my office, 312-649-3087.
Great stuff.
Yeah, thank you. Yeah. So I let everybody know that I'm accessible. I'm here. As we get into open enrollment, use me as a resource, right? We got broker support and customer services. But if you got any questions or you come across any complex situation issues, let me know. We put a face behind AMBETTER. I want everybody to know that you have much support. So, but yeah, thank you. Definitely.
Awesome. We have a bunch of Q&As in there if you want to pop in there at the bottom there.
Yeah. Okay. Q&A. All right. So are the packets to clients with ID cards, etc., referred to sent to the mailbox or email? They're going to be mailed. Yeah, they're going to be mailed to the member, whatever the address is on file. So they'll mail that off. Let's see. The network name change is going to be different from the Medicaid networks. I find a lot of doctor offices get confused between marketplace coverage and the Medicaid networks. You guys do as well. So the network, when you say network, I'm not sure if it's the premier network, like the plan network, right? So I know when members call in, either they in Florida, value. That's why we say members call in, let the doctor know, hey, what plan that you're on. Are you on a value select, or you're on a a premier network? So that communication, as we are working with those providers, to ensure they get the right communication. But if you have any issues around that, and definitely follow up with your account executive like myself. We don't have any issues with people seeing doctors. Hey, they say they don't take this plan, but they should, those type of situations. Can you go over Arizona with AMBETTER? I don't have time to go over Arizona. We do have state webinars going on though, that started this month. So I'm not sure if the agency sent those out, but AMBETTER has. If you need a follow up, or hey, I need the link for state webinars, follow up with me, and I can send that to you. But we do have state webinars going on. Did I miss discounts on gym memberships? Yeah, you did miss the gym memberships. It's called Abinity, ABENITY, Abinity.com. That's our we do have discounts and memberships through there if members looking to lose weight. Contact slide, yes, I can pull up the contact slide. Go to that contact slide. There we go, right there. So in case you need to reach out to broker support, okay, make sure you all check your appointed states. Please make sure that you have the right states that you are appointed in. We don't want any issues going to open enrollment and say, hey, I'm supposed to have this state. I don't see my business come, but it's because you're not appointed. So make sure you double check that, please, right before open enrollment. If you're missing any states, you need to get appointed, just let me know. I'll take care of you. All right, let's see what else here. HMO without states coverage, $0 copay. Yes, $0 copay. What determines which plans have $0 teledoc? Is it just plan level Pacific or the income bracket specific? It's the plan level Pacific. Plan level. Okay. Other stuff coming in. Hold up 1 second. Uh, all right. My client used the drug lookup and went to pharmacy to get the prescription. The price wasn't the same. The pharmacy changed. My client called member services, and the person she spoke with had no idea what the drug lookup from the member site was. He was so unhelpful, and my client was upset, and she paid more for her meds than what the AMBETTER site was telling her. See, when you come across these issues, let me know. If like you say, hey, the member's supposed to pay this, but they went to the pharmacy, they had to pay that. Bring that to my attention, so we can look into it. And then when it comes to everyday standard focus, elite, complete, are these the different names of plans or the network? So everyday standard focus, these are the names of the plan. Name of the plans. Are the networks the value and the premier? Yes, that's correct. The networks are the value and premier, depending on the state, right? So, I went over Florida, Georgia, Tennessee, but, you get in states like, let's say Indiana, Ohio, those have just premier, why are there so many different names of the plans? That I don't know. Our product team making those plans for the members, I totally understand with the amount of plans. So, but yeah, definitely varies by state. With the HMO plans, you need referrals and pick up a PCP. Yeah, you'll need a referral. Is the HMO the value network? Yes, HMO is the value network. Is the Premier network the EPO? Yes, Premier is the EPO. But I'll say this though, those don't have no referrals, but the best you could put a member on is the Premier network. It is, those kind of plans, members can cross state lines, no referrals, none of that. But when you get into those selective value network, it's a bit different. I have a client who enrolled without her knowledge. How do I become her AOR? So what you'll need to do, you'll have to reach out. Well, it's a process, right? So that member, first and foremost, report that agent. If they did that, report that agent first. Okay. Go through the marketplace to make the change as the AOR with the member. Once you do that, you need to follow the process of giving our member services a call. Not you, but the member. They will have to let the member services know, hey, I want to have this agent as my AOR moving forward, and then we'll make the change on our end. But just make sure you do your due diligence on your end and follow the member service. What do you see as far as the plans that have the highest enrollments? I have a lot of clients on Focus Silver for 2024. Has that typically been the plan with the highest member enrollment? That is a great question. And that I am not sure specifically what plan will we seeing a lot of enrollments on, to be honest with you. But if you want to follow up with me on that question, I'll be happy to let you know what that is. Anonymous, so I'm not sure who it is. But my contact is there for you for anyone who wants to follow up with me for any questions, any complex issues that you're dealing with. So
Boy, our agents are putting you to work, huh?
oh yeah, I love it. I love it. Put me to work, man. I'm here for you all. They're like, who's Sunday? Well, hey, I'm your support guy, right? You have a designated and better rep.
Right.
Is there any more questions? Not sure if there's any
No, I think we're good.
questions.
It was very, very thorough, and you answered all the questions. And if anybody has any
Good.
more, they can reach out to you via the contact info.
Awesome, awesome. Thank you all. I appreciate you. Let's have a great open enrollment. Let's take advantage of the resources. Reach out to me for any questions. I don't care if it's something like broker support or anybody can't help you with. I mean, I will do my best to help you. If I can't help, I can't, but I will definitely try and put in the hands of somebody else that can push that through. Okay. So yeah, let me know if anything, and yeah, let's look forward to a great open enrollment, everyone. Thank you.
Thank you, Shondell. Take care.
You too. Thank you.
As for the rest of you folks, we should be kicking off before the 11 or noon, depending on where you live, hour with Mark Capagrossi. So hang tight and I'll throw some tunes on and we'll wait.
Oh, okay, awesome. Well, thank you so much for having me. I really appreciate your time. I know you're being bombarded with all kinds of training, so I really do appreciate you taking the time to come and hear what's new for Molina for 2025. My name's Andrea Espinoza. I am the broker rep. I specialize in California and Nevada, but if you need assistance with any state, please let me know. I would love to connect with you. I'm sure I've talked to most of you, but in terms of open enrollment, if you need any support, you can feel free to reach out. If you need promo items, if you have questions about network, any member issues, I am available to assist you. We have some great information for 2025. I do have a lot of information. I'm going to do my best to get through it and just give you the high level points for each. I'm going to be sharing the slide deck, so feel free to not have to take any notes as you'll have this information with you. So I will get started. In terms of some important dates that I'm sure you guys are all very well aware of, folks are doing their shop and compare and looking at the differences for 2025 from 2024. For California specifically, the active renewals have started, and we do have passive renewals that are going to start in October 31st. And we love passive renewals, right? No changes. Members are happy and they want to keep their plan. That is what we hope for. In Idaho, open enrollment does start October 15th. So again, just wanted to add those dates there, and I hope you find them helpful. And then, of course, we got to add a little bit of Molina. At Molina Healthcare, we've experienced some great growth as of March 2024. We now serve 5.7 million members across 21 states for all of our lines of business. So we want to thank you because this kind of growth wouldn't be possible without you. We want to thank you for your partnership. We know more and more and more the open enrollment time is very challenging because there's so many changes, and you guys continue to navigate folks through some challenging times. And so we want to thank you for all of your guidance and your partnership and hard work. We're very excited of the growth that we've experienced, and we hope to continue to grow with you. And talking about growth, here is our 2025 national footprint. 15 states overall for 2024. We did launch in Nevada. That is our newest state. We launched for OEP 2024. We are statewide in Mississippi and in New Mexico. And then we added some counties in Texas, Florida, Ohio, and Kentucky, 35 counties total. And I'll be sharing a little bit more of the growth that we've had an expansion in the next couple of slides. In terms of expansion, that's where we're going to start first. We're very excited about Florida. This is going to be a key market for us. in 2025. So I'll tell you that we're gonna be expanding Baker, Bradford, DeSoto, Hardy, and Henry. I will go over major selling points, and I hope that that'll be helpful for you overall. Number one selling point for us, no PCP referrals needed to see a specialist. This is something that we've had for other FFM states, but not for Florida. So this is going to be something key and a number one talking point for us. We are also hoping to have some improvement in pricing overall and our price positioning that's going to make us competitive in most of our counties. But again, I think what's going to be most important is that no PCP referral needed. And again, if you have any questions about Florida specific, I can connect you to our rep there. But anything that you need, please let us know. And then next we have Kentucky. We are expanding to 5 counties there. I would say a top selling point is there's going to be no increase for smokers. We don't have many in-state brokers in Kentucky, and that's been a challenge. And, I'll be very honest with you, the enrollment side itself is a challenge. And so that's why our agency partners are so important to us. And hopefully, you can assist us in growing there because we have seen some challenges in terms of just not having enough in-state brokers. So wanted to call that out. Another county or another state that we're very excited about is Ohio. We saw insane growth in OEP of 2024. We are going to continue to see that into 2025. And that is because we're adding bronze plans in Ohio. And that is very, very exciting. Bronze is very important to this state. So we're very happy to be able to add that again to our portfolio. And I would say that's our number one selling point there. Areas of focus are the 3 big C's, of course, Cincinnati, Columbus, and Cleveland. And again, we're going to have a very strong network, and I think that's going to go a long way in growing our membership. And I will be covering our bronze plans in the next couple of slides because that's a very exciting update. And then next, we have the great state of Texas. We are adding 10 counties for Texas in 2025. I'd like to note the addition of Willacy County to the Rio Grande Valley. That is the bottom of Texas at the tip that you'll see there. It is very important because that's border states for us. A lot of activity of folks coming in from Mexico into Texas. There's a huge Hispanic population in that area. I want to say about 90% of folks are Hispanic, and it is a fast growing region. We're seeing more and more people moving into Texas. So again, this is going to be a great opportunity for us. We are also offering off exchange plans for the very first time. We're only doing in Texas. I'm going to be covering later in the presentation of what that's going to look like, but something exciting there to be able to offer that to folks. And then some states with no expansion that are remaining the same in 2025. We do have California. We are going to remain in the same 6 counties in Southern California. And very quickly wanted to add here, and I wanted to add our benefits at a glance. I really like this sheet because it has cost breakdown and it has the plan side by side. We do have this for each of our states, but I wanted to add the one for California specifically because of the changes that we've had. Silver continues to be key, especially for us this upcoming year. Folks with incomes above the 200% FPL line will be eligible to enroll in an enhanced Silver 73, which is very important because that means no deductibles and reduced out-of-pocket costs. And while those under the 200% FPL will continue to have higher levels of benefits. So as you see here, we don't have the Silver 70 because Covered California really wants folks to enroll into a Silver 73. They'll have access to higher levels of benefits at the same or lower cost. So they're even talking about maybe automatically moving folks from a Silver 70 to a Silver 73. So wanted to add that on there. And for these benefits out of glance sheets, anything that's highlighted in blue are services that do not have a deductible. And again, we have this for each of our states for 2025, but wanted to highlight California because of those changes. And in California, we do get our pricing early. So wanted to add here by county what we look like in terms of competitiveness. And so I'm going to start off with San Diego, where we are most competitive. We have low cost silver, gold, platinum, and bronze plans across the board. I think San Diego is going to be our key market there. We have Scripps Network, which is very popular. And then we have all of the federally qualified health centers, the FQHCs, that are also in network. Molina has two one-stop help centers that have opened. These are wraparound services for members. There's food pantry, English classes, activities for kids. If members have any questions, they can go directly into these centers to get assistance, PCP changes, member ID cards. And that is what's great. And I think this is why we've seen such a big growth in San Diego. And again, I think this is going to continue to be a major county. I think as of now, most of our membership does lie in San Diego County. So excited to keep growing there. And then next we have the West LA region. We did see some growth there in OAP of 2024 because we do have Regal. There were other carriers that discontinued their contract there. So we saw some movement of people moving over to Regal. We continue our partnership with that medical group. That's a key medical group for us. In terms of pricing, we're the second lowest cost silver, gold, and platinum. So across the board for all of our plans. And I know it can be a little bit of a challenge when they say region 16 and there's region 15, which is East LA, and there's no like clear line down the middle that separates it. It's more by zip code. But just if you're not in California, basically region 16 comprises the city of LA, Van Nuys, Huntington Park, Malibu, Beverly Hills, West LA, City of Commerce, Santa Monica, Torrance, Linwood, Southgate. Everything below the 5th, but up to the Freeway 5, but up to the 405, I would say would be considered Region 16. And again, if you have any questions or want to strategize about these different counties, please reach out to me. And then Region 17, which is Riverside and San Bernardino, our focus is going to really be retention there as we're third in silver. Orange County, we saw some price improvement. We are second now in terms of silver and our platinum plans, so very excited to grow there. And for Region 13, which is Imperial County, and for Region 15, that's East LA. Again, the focus is going to be retention there as we do have a little bit of a price challenge. And I also want to pause here to talk a little bit about DACA. I know that there's been a lot of talk. I think California is the one that's the most focused on DACA recipients. They're now going to be eligible for plans through FFM market and state-based exchanges. They are estimating about 40,000 who will be eligible in California, maybe 100,000 nationwide. I do think it is going to take the support of brokers, partnering with nonprofits, consulados, community colleges to reach out to these folks to get them in the door and enrolled. They can shop around for a plan in November and have an effective date of December 1st, so SEP, and then they can also shop around for a 2025 plan. So very important to note that. Something too that's I think a key talking point is that they are now part of the mandate. So they have to have insurance so that they don't get that penalty in California. So something important to note there. They are going to require documentation as DACA is not a permanent status, but they will need some kind of documentation to prove that. I did ask what that will look like if they would require additional documentation throughout the year, but it looks like it's just at the beginning when they enroll. Even if they lose their status throughout the year, as long as they pay their premium payments, they get to keep the coverage. It's just when they renew, if they don't have an updated status, then they can't re-enroll. But again, just some important information that I wanted to share regarding DACA because we are getting some questions about that. And then next we have Idaho. No changes in terms of footprint. We're going to stay in the 7 counties. I did want to share some preliminary rates here. As you can see, Molina is at a 2% decrease. Any kind of decrease is exciting, especially because we're seeing other carriers taking on some increases there. So we are hoping to see some good pricing due to this. And here are some of the providers. We do get questions a lot about our network, so we wanted to add. I won't go through each one, but wanted to have this available to you in case you do get questions about major providers in Idaho. Next is Illinois. I think some key selling points here is no higher premiums for smokers. We have a very strong network for 2025. We're adding Advocate Healthcare, which is awesome to be able to say that we're adding that on, and I think it's going to be very helpful. And we're going to continue our partnership with Rush University System. I believe we added them on in 2023, so we're going to continue that partnership. So very important to note that there. In terms of that. And then next we have Michigan. We're going to continue to have a strong network in Michigan. We did see that there's other carriers that are taking on higher increases, about 17% for 2025. So I think that can give us a little bit of a competitive edge for that state. And then next we have Mississippi. We are statewide here. I think a top selling point for us is that we're expanding our network. We've included St. Dominic's Hospital in the Jackson area. Very excited about that. I think something to note too for Mississippi, it is that it's not a Medicaid expansion state. So again, these folks will have to go through ACA for enrollment. So very, I think, important to note that. And then next we have New Mexico. We are also statewide here. This is our state-based exchange. I think in terms of pricing, the Albuquerque area is where we're going to be most competitive for 2025. And then next we have Nevada. That is one of my territories. I'm a little bit biased, favorite of mine. For this, we had some pricing challenges. We launched in OEP 2024. For 2025, we're going to continue to have that price gap. But our overall goal is to stabilize our pricing here, but it is going to take a little bit of time to do that in a couple of in open enrollments. So wanted, to be very transparent about that. There are some provider challenges that the state is experiencing. So all the carriers are in the same boat. But for us, we've been lucky to be able to partner with most of the providers. I would say we have about 1,500 PCPs that are in network for Nevada, and that includes the Comprehensive Cancer Centers of Nevada. I do get a lot of questions about that, so that is included. And I think another important thing to note is that no PCP referral is required. So very important there. And then next we have South Carolina. In terms of top selling points, we do have a strong network. We know that there might be a carrier exiting the market here, so I think that's going to be a great opportunity to move folks over to Molina. And then also there is no Medicaid expansion here either, so something important to note. And next we have Utah, no changes to the footprint. I do have some information about the preliminary rates here. As you can see, we have the lowest increase compared to other carriers. Cigna is exiting the market and folks are going to be shopping for new plans here. So very important to note. And I think in terms of competitiveness, I'm going to go back to the map here. I think it'll probably be the St. George area. In terms of a key place. And then this is a list of our providers. And for Washington, again, no changes to the footprint, but I do have information about the preliminary rates overall. And Molina took on the lowest increase compared to other carriers. So again, very good to see, and it makes us hopeful that we're going to be competitive overall. Wanted to add some information about our major provider groups if you do get questions about that for Washington. And a reminder that folks in Washington wanted us to add the exchange. For them, it is very important to gather information about race and ethnicity. So if you are completing enrollments in Washington, they wanted us to add this little note to you of how important it is to gather that information because it helps address disparities, it informs health programs, services, and ensures access and assistance in policy development. So very important. Just wanted to add that reminder when you are completing enrollments in Washington. And then last but not least, we have Wisconsin. And again, I'll be very transparent with you. Wisconsin is a challenging market because of the pricing, but it's because we have such a great network that it increased the premiums. So there, as you know, it goes hand in hand, but we do have a very strong network here. And I think that's a top selling point for Wisconsin. And then next, I'm going to go into some very important member resources that I'd like to share with you, and hopefully you can pass on to folks as they're asking about Molina. We do have our member rewards program. It is now called our Molina Healthy Rewards. We used to call it the Health Perks Program. I think it sounds better to say Molina Healthy Rewards, so very happy about that. It is an interactive program. It offers different programs for our members, smoking cessation, asthma, heart disease, depression, diabetes. So very awesome to be able to pick from different programs. Again, everything is interactive. It does come with a $200 gift card incentive. There's different vendors that they can choose from for their gift card. And in order to receive the incentive, they need to complete their annual wellness assessment exam and their a wellness assessment and their physical. Those are the most important things for them to complete, and then they can take advantage of that $200 gift card. They can sign up through their member portal, My Molina, be 18 years of older, and it is completely free. So wanted to add that on because it is very important. And members are already going to be doing their annual exam, so why not do their wellness assessment too? We really want to make sure that we're engaging members in their health. We're seeing that they're signing up for plans, but not taking advantage of the preventive services. So we're hoping that this is going to engage folks and just have a proactive approach to their health. Again, if you have any questions about the program, please let me know. And I just want to quickly note that for Washington, the gift card incentive is $100. And next we have our prescription solutions program. This is a new program that we launched, I believe, at the end of 2023, 2024. And basically, it's for members and it helps them maximize their prescription benefits and lower their out-of-pocket costs. I've added the phone number here in case folks have any questions. It does come in their welcome packet of how to sign up. But again, folks can use the phone number here to sign up for the benefits. It's very easy to make an account. If I could say there's a number one tool for us, that would be the member portal and our mobile app. That is number one. We get a lot of questions into our member services department about, hey, I need to make a PCP change. How do I, or then I lost my member ID card. I'm sure you guys get questions a lot about that. If the member downloads their My Molina, creates an account, they have access to their electronic member ID card and they'll have it at the pocket of their hand. If when they go to the doctor, they'll be able to show that. I think that's the number one most useful thing that we have on here. They can also make PCP changes at any time, which is really great. There's member forms, member resources. They can find a pharmacy directly from the app. They also have access to their member handbook. At the top, it'll say green if they're eligible, if their plan is active and their coverage. And if there's any coverage issues, it'll show it in red, which I think is very cool. They can make payments directly on there. And I think an underutilized tool is if they're getting any kind of procedure and they want an estimate of what that would look like, they can do that directly on the app. That's an option. So I just wanted to call that out as a very cool tool that is available. And then wanted to add our member resources information here, especially with open enrollment. Members want to know who they can call, so wanted to add that information. And we can't talk about open enrollment without talking about payment options. You guys work so hard in enrolling members, and it's so frustrating when they don't make their binder payment and they don't effectuate their coverage. So we want to make sure that members are aware of all the different payment options that are available to them. And as you can see here, we've got a lot of payment options. Of course, our preferred method is auto pay, but we know that that's not always possible for the members. So we do have our one-time payment, which is really awesome. I think that's my favorite. It's very easy to use. And we did add a Google Pay and Apple Pay option to that. They don't need to make an account, and it is very easy to use. They can use it as many times as they want. They can pay by phone, by mail, or by MoneyGram. And then we did add a new option for 2025. They can make in-person cash payments if they would like. We have about 30 payment sites that are available to them. And I did add the link here so that they can locate a center to make a payment. So again, making sure that they have as many easy options to make their binder payments. And also, we get folks that are new to Molina and maybe don't understand how to read their statements, their billing statements. So I totally understand that that can be a challenge. Or they have questions about their premiums, they can call our enrollment and premium center and get those questions answered. So I added the phone number for each of those states. So I hope you find that helpful. And then we're going to go into our benefits information. We're going to continue with our value basics, telehealth, which of course was $0. That's embedded in all of our plans. No cost preventive services, screenings, pediatric vision services, prescription solutions, and our 24/7 nurse advice line, all included in our plans. And of course, our wellness incentive program, again, available for all of our plans. And we know that you guys receive a lot of trainings for all the different carriers, and it can be hard to keep track of what's available for each one. So I hope you find this very helpful. I know I do. It gives you a nationwide view of our product portfolio for all of our states and what's available in each. At the top, you'll see our FFM states, and at the bottom are our state-based exchanges. Again, it shows you each of the products that are available. So I hope you find that very helpful. And you'll see here even our off exchange. So again, very handy to have. And then next, onto our bronze plans that we are very excited about. First is the bronze 4. That's going to retain a $0 medical deductible for Florida and Mississippi. We do have the bronze 9, and that is aimed for our higher utilizers who tend to exceed their maximum out of pocket. And just wanted to quickly note that that excludes Franklin County in Ohio. We're not allowed the bronze there. Same for bronze 10, it excludes Franklin County from Ohio. And this is our low deductible option, which is aimed at low to medium level utilizers. And then, of course, we have our standard bronze. That's for Florida, Mississippi, Ohio. And that is our standard CMS designed option. And added here the cost for each one side by side. So I hope you do find that helpful. And again, that's going to be huge in Ohio. And then next is a silver. So we got silver 1, which is intended to be our buy-up option for folks. And as you can see here, it has a $0 deductible. And then my favorite, which is the silver 12, which has 4 free PCP visits, which I think is huge. And then we added that information side by side for you. So we hope that you do find that very helpful. And then next, we do have our FFM Gold portfolio. We have the Gold one that is designed as our low-cost sharing option, and it is consistent with 2024's option. And you will see a minor reduction in generic prescription drugs, which I think is great. And of course, we're going to continue with our standard state-mandated Gold plan for that. So again, wanted to share that information with you. And then we do have the Gold 12 that is for Texas. And then very quickly, in terms of Teladoc, very excited to announce this. Not only do we have virtual medical care, but now we do have mental health at $0, which is awesome. We are very excited to announce that. We know how important mental health services are. Sometimes members say that they have a hard time finding someone local, and sometimes members don't want to leave the comfort of their home, which we totally understand. And so we hope that this is going to be a really great option for them and that they'll take advantage of mental health services through Teladoc. And then really quickly, just some information about our adult vision plan that is available with some of our silver and gold one plans. If you visit the VSP site, it does give you all the in-network providers, but wanted to add that here. And our off exchange that we're very excited. Our off exchange plans are really geared to those folks that don't qualify for any tax credits or, usually they've gone through the plan, they'll see that they don't qualify for anything. If they do go through the off exchange plan, something to note is that there's no CSR that's available. So just wanted to point that out really quickly. This is what our portfolio looks like for our off exchange plans, the silver 1, silver 3, 8, and 12. And then we will have the gold 1, gold 8, and gold 12, with some adult vision services available for the silver 1 and the silver 1 and the gold 1. And then here is a breakdown of the different costs for each one from our on exchange to our off exchange. As you'll see here, there's a little bit of a reduction, but this is what it'll look like. Again, want to be very transparent about the cost here, and I hope you find this helpful as you get questions about our off exchange. We try to mirror the on exchange as much as possible. And if you're asking what will that look like as you're enrolling members, I'll share that in the next slide. Really quickly wanted to note that our Silver 3 was offered on exchange for 2024, but we're going to move it off exchange for 2025 for folks. And there's a little bit of a reduction in the out-of-pocket max. And in terms of what that'll look like when you're enrolling members, if you do have someone who's interested in an off exchange plan, didn't qualify for anything on exchange, we're going to be using Health Sherpa as our enrollment site. If you're in the agent dashboard, at the very top, there's going to be a drop down when you can select to quote off exchange. They do want us to let brokers know that if you have folks that have ICRA, they can add their ICRA amount so that it does calculate that in their final premium. So very important to add that. And once you select that you do want to continue with the off exchange, it'll reroute you to the application. But they really want to make it as easy as possible to complete these off exchange enrollments. If you have any questions about this, please let me know and I can gather that for you. And then on to providers. Next to pricing, in network providers is very important. Our overall network, we do have our provider directory that is very easy to use if you need urgent care, hospitals, PCP, or specialist. I love that you can download this as a PDF or you can copy the link and you can send it to your members and it'll show all the search results. I utilize this site all of the time. If there's something you're not seeing here, or maybe you're not sure if they're in network, you can always send me a message and I can talk to our provider team and confirm that they are in network. And then some very important broker resources that I wanted to share with you. We do have our benefits flyer that is available. We have a Molina marketing store. You can go on there, you can log in, and you can select copies of each of these, and you have up to 50 copies that can be sent to you directly to your home, printed and ready to go. So wanted to make sure that you are aware of that. When you log in, you'll see Medicare and you'll see Marketplace. You can click on that and you'll have access to all of our marketing materials in English and in Spanish to order. And you can click on the QR code to get access to that. And as you can see, we're getting very fancy now. We got our benefits brochure that is also ready to go for 2025 that you can order. And this is our benefits at a glance plans that I had talked about. We have it for each one of our marketplace states. I love these. I think they're very useful for the members to see side by side our plans. And again, the QR code is included, so you have access to our Molina marketing store. We have our state fact sheets that's more geared towards brokers. It really gives you an idea of just the main selling points and the benefits for each of our markets. What I like about this is that it includes all the hospitals that are in network. So again, that is available in our marketplace website. And this is our marketplace website. It's basically a hub for all the information. Anything you can think of as a broker, as a member, you can have it here. If you need to make a payment, download any forms. If you need access to your broker portal, you can do it through this site. So again, wanted to call that out, as it is very important. And we do have our broker support unit who's available to assist you. Great group of people out of Utah. They are very knowledgeable. If you have commissions issues, contracting issues, if you have questions about a member's premium, if you are seeing that there's an access to care issue, please send us an email and they can assist you and they're ready to go. You can contact them by phone number or through their email here. But they're a great group of people that, again, are just ready to assist you. You don't have to have the member on the line with you. Just send us an email and we can help you out. And then, of course, wanted to add some reminders. As you are gearing up for open enrollment, it is very important that you are in ready to sell status, meaning that you make sure that you've declared the states that you're selling in, that you've completed all of your required certifications, whether that be state-based or FFM certifications. You are here today at the Molina training, so you've already got that out of the way, which is great. But again, please log on to your broker portal and verify that your license is active, that you've declared the states that you're selling in, and that you're ready to go. If you're not sure, please send our broker support unit an email and they can verify that you're in ready to sell status. But we don't want you to miss out on any commissions. That's why we're adding this reminder. Please make sure that you are ready to sell. And very quickly, our broker portal. This is our #1 tool for brokers. We've added a QR code here that'll take you directly to that portal. Please utilize it. Make sure that you can log in. If you're having any issues with logging in, please send our broker support unit a message. They can reset your password or they can change your email address if that's the issue. But we want to make sure you have access to your book of business. That is very important, especially with open enrollment around the corner. For your book of business, it'll show you paid through dates in real time, which is very important, making sure that your members have completed their binder payment. It shows effective dates. And again, any information that you need is directly on here in terms of your book of business. Also, if anything's missing, you can let us know and we can add it on. That happens often, that there might be something that's missing and we can add it on to your book of business. A very important functionality that was added is ID cards and PCP changes. Again, this is the #1 thing that members ask us about. So it's awesome that brokers can go in and make these changes themselves. So you can go in there and select PCP changes or select that ID cards be mailed directly to the members. If you log into your broker portal, there is a resources page and it does have information on how to navigate the site and the different functionalities. We also offer trainings that you can join in on, and then I'll cover that in the next slide. But again, we want to make sure that you are logged in and then you're comfortable with the broker portal. And then really quickly, just wanted to add this reminder of best practices. I'm not going to go through each one of these. You guys are all well-seasoned brokers that have been doing this for a very long time. But with all the CMS changes that are happening and AOR issues that I'm sure you're well aware of, we just wanted to take the time to remind all agents about best practices. And then this is our marketplace sales team. Again, my name is Andrea Espinoza. If you need anything, please let me know. I'm your broker rep, but we do have a great team of people throughout the United States ready to assist you. At the very top, we have our director, Fabian. He cracks the whip on us. He is out of Miami, but again, this is our team. We do have more trainings that are available. So if you're interested in maybe a training in Spanish or specific to a state, if you want to learn more, we do have an agent center and you can sign up for trainings there. But again, just want to thank you so much for your time. I hope you have a wonderful open enrollment season. We thank you so much for your partnership. Again, if there's anything that I can do for you or if you have any questions, please let me know.
Andrea, thank you so much for this training. We did have some Q&A in the bottom there. If you want to pop that open, maybe you can answer a couple of those.
Yeah, let me see. Okay, I got a question here. No PCP for Texas. So yes, no PCP referral needed for specialists in Texas. That is correct. Do you guys give coverage for weight loss drugs? So that's a tricky one because it does have to be approved. So there does have to be a medical diagnosis given for that to approve. It can't just be weight loss only. But again, that does have to be approved and it does depend on the PCP. I would say. And can you put the contact number and emails? Yeah, of course. I can give you my contact information. I'm sure they can share it with you. And then I'm also going to send the slide deck so that you have all this information. And as questions come up, you can feel free to reach out to me. And I think that's it.
I really appreciate you coming on, and you have a good weekend.
Yeah, thank you so much, everybody.
And folks, this concludes our ACA University. If you have any questions, please reach out. Appreciate you all. Take care. Happy selling.